This video explains all about psychological well-being. I am joined here by my colleague Aisling to explain what you need to know.
Common early reactions to spinal cord injury. In the beginning, the main focus is usually on physical changes. It can take some time to fully consider the psychological effects. Everyone experiences spinal cord injury or illness differently. There is no right way to react, and no one-size-fits-all approach to dealing with spinal cord injury. However, there are common emotions and feelings which are part of a typical or usual reaction. Traumatic spinal cord injury is usually sudden and unexpected, and it can take time to make sense of what has happened. Soon after injury, it is common to feel shock, numbness, or disbelief. Non-traumatic spinal cord injury may be less sudden or unexpected, but can lead to shock and disbelief. Mixed emotions are expected at the early stages, as you think about what spinal cord injury might mean for your life. Feeling sad, angry, scared, lonely, or out of control are typical reactions. Uncertainty can produce anxiety and confusion. Disappointment and regret are also common. You may also feel a sense of relief or feel lucky because you have survived a traumatic event. After spinal cord injury, many people worry about what the future will be like. Others will focus on just taking one day at a time. It can be hard to imagine at this early stage how things can possibly work out well for you. It is common to feel that it will be impossible to cope or to achieve all your hopes and plans. No matter how emotionally strong you are, the trauma of a spinal cord injury can shake your sense of yourself. It can bring up lots of questions about the meaning of life, the things you took for granted before, and the value of friends and family. It also asks you to find coping skills that you may never have needed before. Everyone who experiences a spinal cord injury will have met other challenges in their lives. Even if those challenges were small in comparison, the same skills can be used to cope with life after spinal cord injury. Sometimes previous losses, mental health issues, or life events can become important again following spinal cord injury and can affect how you react. Counselling gives you a chance to review many aspects of your life, including spinal cord injury. Talking to other people who have experienced spinal cord injury is a really valuable way of learning from lived experience and benefiting from peer support. The early months following spinal cord injury can be a difficult time. However, it is possible to deal with spinal cord injury and to continue or get back to enjoying life again. In time, you may discover strengths that you did not know you had and develop confidence as you learn new skills and interests. Adjustment is talked about a lot in rehabilitation. It is a word that can be easily misunderstood. It does not mean giving up hope for improvement or just accepting what has happened. It means taking the time to adapt and get used to a changed situation. It means recognizing that this is how things are right now and finding ways to move forward in ways that are important to you. Wishing that the illness or injury had never happened is normal. Hoping for a cure is normal. However, concentrating mostly on the past or on how you want things to be different can lead to depression and block the process of adjustment. Learning to think of your injury as a challenge which brings with it a set of problems to be solved is hard but helpful. Denial of the consequences of injury is not at all unusual in the early days. Denial can allow reality to seep in slowly. Identity means how I see myself. It is related to self-image and self-esteem, and a sense of yourself as continuous throughout your life. Spinal cord injury can cause a disruption or break temporarily or permanently in that sense of self and continuity. Many people say that in the months after injury, they experience a loss of identity or purpose, or they have experienced changes in important roles in relationships, families, and workplaces. It can be really hard to imagine being that person again. People also may feel confused about the identity changes or think that they are a burden to others. These feelings are natural. However, it is also very common to have them fade over time as new goals and a sense of purpose take their place. While your life may change in all sorts of ways as a result of spinal cord injury, there is much that remains the same. This sense of continuity as well as change is something that becomes more obvious with time. In the early weeks and months, the sense that everything is different can be very strong and even overwhelming. However, the sense of being still me becomes stronger as relationships, activities, and events are important again. You are not just the things you do, but what you think, value, and feel. Roles and interests can change and be redirected with time. Doing the things that matter to you is important, even though you may be doing it in a different way. Sexual identity. Sexuality is a central part of who we are, what we believe, and what we feel and how we respond to others. It includes all the feelings, attitudes, and behaviors that make up our sense of being a sexual human being. Sexual well-being is your level of satisfaction with sexual functioning and the importance of sexuality in your life. It includes satisfaction with both the emotional and physical aspects of your relationships. The Sexual Wellbeing Service provides information and counselling in a private and confidential setting and in a non-judgmental way. It provides information on the direct and indirect impact of illness or disability on your sexuality. It provides information on aids and appliances to improve sexual functioning. It provides information and arrangement of appointments for fertility programs. It can provide individual and couple counselling, psychosexual therapy if required, and advice and information on contraception and safe sexual practices. Managing stress. There are many ways to manage the stresses that come with spinal cord injury. While you may not be able to get rid of stress, you can find ways to reduce it. Here are some practical suggestions. Find ways to relax your body. This can include breathing exercises, muscle relaxation exercises, mindfulness, and massage. Pacing is important. Learn to plan your time and activities to take account of your energy levels and abilities. Prioritize the things that matter most to you. Explore the ways you cope with stress. Find what does and what does not work for you. Be open to thinking about other things that might help. Take exercise. Regular exercise is one of the best ways to manage stress. Spinal injury alters the way you take exercise, but it's very important to find exercise that is suitable for you. Take good care of yourself. Get plenty of rest, eat well. Work on letting go of things you cannot change. Learn to say no. Express your feelings. Not being able to talk about your needs and concerns can create stresses and make negative feelings worse. Talk, laugh, cry, and express anger when you need to with someone you trust. Write it down. It can help to write about the things that are bothering you. Ask for help. People who link with their network of friends and family manage stress better. Consider seeing a counsellor or therapist if negative feelings or thoughts continue to bother you. Try to find humour in situations. Laughter reduces stress hormones. If you are having a bad day, think about how much progress you have made since you first became ill, rather than focusing on how you used to be before spinal cord injury. Managing pain. Pain can be one of the most difficult consequences of spinal cord injury for many people. Different types of pain can develop after spinal cord injury, including musculoskeletal and neuropathic pain. People with spinal cord injury can also get visceral pain. Depending on your level of injury, visceral pain can affect your internal organs. The difference between acute and chronic pain is the most important thing to understand. Acute pain flares up and fades away with or without treatment, and in a relatively short period of time. Chronic pain continues after the expected time for recovery and is always present to some extent. While treatment and pain relief are still important, chronic pain needs to be managed on a daily basis. Learning to live with pain is a very difficult thing to do. It takes time to change your thinking about pain in order to help you to manage it well. It is natural to think that there must be medication that can reduce pain, but sometimes medication can only help dull the pain or doesn't help at all. Often there is no one way to lessen pain. Living well with chronic pain means doing lots of different things to make pain manageable. The aim is to reduce the effect of pain on your life. The real challenge is to live your life despite the pain rather than stop living life because of the pain. Self-management is what people do on a day-to-day basis to feel better and to live the life they want. Here are some tips to manage pain. Speak to your health professionals during your rehabilitation about strategies to help you manage your pain. Learn self-calming, breathing, relaxation, or mindfulness strategies. When your brain is more relaxed, your body hurts less. Make a habit of using these techniques on a daily basis. Build up a collection of active distraction techniques. Creative activity, pets, reading, watching TV, socializing, gentle exercise and massage can all help to lessen the effect of pain. Add physical activity to your day and be careful not to overdo it. Your body needs to keep engaging in activities in order to create feelings of well-being. If searching for apps or information on the internet, ensure to access those with good quality pain management information, such as Chronic Pain Ireland or Pain Management Network Australia. Identify unhelpful ways of thinking that can make pain take a central place in your life. It is possible to challenge negative automatic thoughts. Be patient with yourself, as it takes time to change the way you think about pain. One of the most harmful negative automatic thoughts is described as catastrophizing. This includes thoughts like, I cannot live like this, I cannot work again, I cannot have a relationship, I cannot be happy unless this pain goes away. It can lead to anxiety, isolation, and increased pain. Pacing is one of the most important strategies to help you manage pain. It means not getting stuck in a cycle of bursts of activity followed by feelings of being exhausted. It also means planning activities and rest periods so that your pain does not flare up. Set small, realistic goals and give yourself credit for achieving them, no matter how small they seem. Consider using a pain diary to track your daily pain, medication use, and activities for a week. You may notice patterns that could help you to find triggers and to develop strategies to reduce the distress caused by pain. Pay attention to your sleep, diet, and alcohol intake, as they can all affect your mood and your experience of pain. Keeping a food, alcohol, and sleep diary can help to identify common triggers or patterns. Ask for help and find ways to communicate about your pain, especially to people close to you. It is tempting to avoid social situations because of pain, but social situations can help distract you from pain. Learn how to deal with flare-ups. Use medication to help with flare-ups. Talk to your pharmacist about your pain medications. Seek counselling or therapy if pain causes excessive stress, mood, or relationship difficulties. Thank you for your time, and I hope you find this information useful.